You're told you're ready for discharge, handed some papers, and sent out the door. But what hospitals aren't telling you is that the decision to send you home often has less to do with you being fully recovered and more to do with insurance companies, bed shortages, and financial pressures that prioritize moving you out over keeping you safe. The first truth hospitals hide is that discharge decisions are heavily influenced by insurance authorization, not just medical readiness. Your insurance company has approved a certain number of hospital days for your diagnosis. When you're approaching that limit, there's enormous pressure to discharge you whether you're truly ready or not. Hospitals lose money when you stay beyond what insurance will cover. Here's what's happening behind the scenes. Your doctor thinks you need 2 more days, but insurance says they'll only pay for 1 more day. Hospital administration pressures the doctor to discharge you tomorrow. The doctor compromises by discharging you with home health services. You feel like you're being kicked out too early because you are. Financial considerations overruled medical judgment. The second truth they hide is that stable enough for discharge doesn't mean you're recovered or even safe. It just means you're unlikely to die in the next 24 hours. Hospitals discharge patients who are still weak, in pain, needing assistance. The standard isn't, "This patient is well." It's, "This patient isn't sick enough to require hospital-level care anymore." Here's what this means. You're sent home still needing significant support, and suddenly your family becomes your unpaid healthcare team. They're managing medications they don't understand, watching for symptoms they can't interpret, providing physical care they're not trained for. The third truth hospitals hide is that discharge planning often starts before you even arrive. For elective surgeries, hospitals calculate expected length of stay before you're admitted. You're assigned a discharge date based on diagnosis, not your individual progress. If you're having hip replacement, you're scheduled for discharge on day 3, regardless of how you're actually recovering. Here's what patients don't realize. You're being compared to statistics and averages, not treated as an individual. Your unique complications or slower healing don't change the predetermined timeline unless they're severe enough to justify medical necessity. The fourth truth they hide is that you're being discharged with instructions you don't fully understand, and nobody's verifying that you comprehend them. A nurse hands you a stack of papers, rushes through instructions about medications, wound care, activity restrictions, and warning signs. You're overwhelmed, maybe still on pain medication, and you nod along without really understanding. Here's the reality. Studies show that patients retain only about 20% of medical information given verbally, especially when stressed and unwell. Discharge instructions are often written at a college reading level when average health literacy is much lower. You're set up to fail. The fifth truth hospitals hide is that they're discharging you before test results come back or before consultations are complete. You had labs drawn this morning. The results won't be ready until this afternoon, but you're being discharged at noon because your room is needed. If those labs show something abnormal, you'll get a phone call later. Maybe. Here's what's dangerous. Critical results can be missed during transitions. You're discharged, the abnormal lab gets flagged, but the hospitalist who discharged you has moved on. Your primary care doctor doesn't know about the hospitalization yet. The abnormal result sits in the system while you're at home assuming everything was fine. The sixth truth they hide is that follow-up with your primary care doctor in 1 week is often impossible, and hospitals know it. Most primary care physicians are booked weeks to months out. You can't get an appointment in 1 week. You're told to follow up, but nobody actually helps you make that appointment. Here's what happens. You don't get the follow-up appointment. Symptoms worsen. You end up back in the ER. The system failed you, but it looks like you failed to follow discharge instructions. The seventh truth hospitals hide is that you're being sent home with medications you can't afford, and nobody verified you can actually get them. The doctor prescribes 3 new medications. You get to the pharmacy and your insurance doesn't cover them. The cost is $600 out of pocket. You can't afford it, so you don't fill them. Here's the system failure. Hospitals have pharmacists and social workers who could help find affordable alternatives, but discharge happens so fast that these resources aren't utilized. You're handed prescriptions and expected to figure it out. The eighth truth they hide is that home health services promised at discharge often don't materialize or are inadequate. You're told you'll have a nurse visiting 3 times a week and physical therapy twice a week. Reality: the home health agency is short-staffed. You get one visit the first week, then nothing. Here's why this happens. Hospitals arrange home health services but don't control those agencies. The agencies accept referrals they can't always fulfill. The hospital gets credit for arranging services and discharges you, but whether those services actually happen isn't the hospital's problem anymore. The ninth truth hospitals hide is that readmission within 30 days is so common there are financial penalties for it. Yet hospitals keep discharging patients too early anyway. Medicare penalizes hospitals with high readmission rates. Hospitals know certain patients are likely to bounce back: congestive heart failure, COPD, pneumonia. But the pressure to discharge outweighs the risk of readmission penalties. Here's the calculation. It's cheaper to risk a readmission penalty than to keep you in the hospital additional days insurance won't pay for. You're caught in a financial equation where your individual well-being is weighed against hospital profit margins. The 10th truth they hide is that discharge is frequently timed to avoid weekend or overnight responsibility. Doctors push to discharge patients Friday afternoon before the weekend. Hospitals discharge patients at 9 p.m. after the day shift leaves, so night shift deals with any immediate complications. Here's what this creates. You're discharged Friday evening with new symptoms. Over the weekend, things get worse. You can't reach your doctor. You end up in the ER Sunday night. If you'd been kept until Monday, the complication might have been caught in the hospital. The 11th truth hospitals hide is that your discharge paperwork often contains errors, wrong medications, incorrect dosages, missing instructions. Nobody double-checks thoroughly because discharge is rushed. You're handed papers with mistakes that could harm you if you follow them exactly. Here's the danger. You take the wrong dose because the paperwork says so. You don't take a medication you should be taking because it's not listed. These errors happen constantly, and the burden is on you to identify them. The 12th truth hospitals hide is that if you feel you're being discharged too early, you have the right to appeal. But almost nobody tells you this. Medicare patients can request an immediate review if they think discharge is premature. Most patients don't know this right exists. Hospitals don't advertise it because appeals delay discharge and cost money. Here's what you can do. If you genuinely believe you're being discharged unsafely, you can refuse to leave and demand to speak with patient advocates or hospital administration. You have more power than hospitals want you to know. What really happens when hospitals send you home is a system-wide failure disguised as successful treatment. You're discharged based on insurance authorization and bed availability more than medical readiness. You're given instructions you don't understand for follow-up. You can't access with medications you can't afford and support services that don't materialize. You're sent home too early, too sick, too unprepared. And when you come back sicker, the system blames you for non-compliance. Hospitals hide these truths because acknowledging them would require systemic change. Better discharge planning, longer stays, more resources, improved follow-up, all of which cost money. Understanding what's really happening when you're discharged doesn't fix the broken system, but it helps you advocate for yourself, ask better questions, demand better support, and recognize that when discharge feels too early, you're probably right.